Wilson disease, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Wilson Disease, Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of Wilson disease. Chapter 1. 1. What is Wilson disease? Wilson disease is the presence of excessive copper accumulated in the body. 2. Wilson disease is also called hepatolenticular degeneration. 3. Is Wilson disease a genetic disorder? Yes, Wilson disease is a genetic disorder. 4. Is Wilson disease a rare disease? Yes, Wilson disease is a rare disease. 5. Is Wilson disease a progressive disease? Yes, Wilson disease is a progressive disease. 6. Can Wilson disease be fatal? Yes, Wilson disease can be fatal. 7. Can Wilson disease happen to anyone? Yes, Wilson disease can happen to anyone. 8. Is Wilson disease an autosomal recessive trait? Yes, Wilson disease is an autosomal recessive trait. 9. What is an autosomal recessive trait? An autosomal recessive trait is when a person receives one copy of the defective gene from the father and another copy of the defective gene from the mother. 10. What is a gene? A gene is a DNA segment. Chapter 2. 1. Give another name to Wilson disease. Wilson disease can also be called copper storage disease. 2. What is mutation? Mutation is a change in DNA sequence. 3. What mutation gene causes Wilson disease? The mutation gene that causes Wilson disease is ATP7B. 4. Can Wilson disease cause kidney stones? Yes, Wilson disease can cause kidney stones. 5. Can Wilson disease cause arthritis? Yes, Wilson disease can cause arthritis. 6. What is arthritis? Arthritis is joint inflammation. 7. Can Wilson disease cause osteoporosis? Yes, Wilson disease can cause osteoporosis. 8. What is osteoporosis? Osteoporosis is a disease that causes decrease in bone density. 9. Can Wilson disease cause osteophytes? Yes, Wilson disease can cause osteophytes. 10. What are osteophytes? Osteophytes are bony tissues that grow out of a bone. Chapter 3. 1. Can Wilson disease lead to cirrhosis? Yes, Wilson disease can lead to cirrhosis. 2. What is cirrhosis? Cirrhosis is the scarring of the liver. 3. Can Wilson disease cause bipolar disorder? Yes, Wilson disease can cause bipolar disorder. 4. Can Wilson disease cause psychosis? Yes, Wilson disease can cause psychosis. 5. Can Wilson disease cause hemolysis? Yes, Wilson disease can cause hemolysis. 6. What is hemolysis? Hemolysis is the destruction of erythrocytes. 7. Erythrocytes are also called red blood cells. 8. Can Wilson disease cause anemia? Yes, Wilson disease can cause anemia. 9. What is anemia? Anemia is an insufficiency of healthy red blood cells in the body. 10. Can Wilson disease cause brain damage? Yes, Wilson disease can cause brain damage. Chapter 4. 1. Can Wilson disease cause insomnia? Yes, Wilson disease can lead to insomnia. 2. What is insomnia? Insomnia is a sleep disorder that causes sleeping difficulties. 3. Can Wilson disease cause hypotension? Yes, Wilson disease can cause hypotension. 4. Can Wilson disease lead to involuntary weight loss? Yes, Wilson disease can lead to involuntary weight loss. 5. What are the signs and symptoms of Wilson disease? The signs and symptoms of Wilson disease are liver disease, jaundice, ascites, fatigue, nausea, vomiting, edema, liver failure, depression, esophageal varices, dysphagia, dysarthria, rigidity of the muscles, tremor, Kayser-Fleischer rings in the eyes, irregularities in menstruation, amenorrhea, infertility, itching, pain in the abdomen, sunflower cataract, etc. 6. What is jaundice? Jaundice is the yellowing the skin, the sclera, and the mucous membrane due to excess bilirubin. 7. What is edema? Edema is swelling due to the accumulation of excess fluid in the tissues. 8. What is ascites? Ascites is a collection of fluids in the abdomen. 9. What are esophageal varices? Esophageal varices are swollen veins in the esophagus. Chapter 5. 1. What is dysphagia? Dysphagia is difficulty swallowing. 2. What is dysarthria? Dysarthria is a disorder that causes difficulty speaking. 3. What is amenorrhea? Amenorrhea can be defined as the lack or absence of menstruation. 4. What is liver failure? Liver failure is when the liver can no longer exert its function properly. 5. Liver failure is also called hepatic failure. 6. Normally, how does the liver treat Cooper? Normally, the liver filters out of the excess Cooper in the body and release it through urine. 7. Can Wilson disease be prevented? No, Wilson disease cannot be prevented. 8. What kind of foods should be avoided in a person that has Wilson disease? Foods high in Cooper such as nuts, chocolate, etc. should be avoided in a person that has Wilson disease. 9. What is ceruloplasmin? Ceruloplasmin is a protein that is synthesized in the liver. 10. How is Wilson disease diagnosed? Wilson disease can be diagnosed by a physical exam, blood tests, urine test, biopsy of the liver, an eye exam, genetic testing, MRI, CT scan. Chapter 6. 1. Can antihistamines increase the frequency of urination? Yes, antihistamines can increase the frequency of urination. 2. What is biopsy? Biopsy is a medical procedure that takes a sample of a tissue in order to be tested. 3. What are the treatments for Wilson disease? The treatments for Wilson disease are medications such as chelating agents that removes excess copper, then medications that maintain the normal levels of the remaining Cooper in the body, and then continuous maintenance, liver transplant, etc. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding Wilson disease.